Hi, I'm Dr. Annie Savage. I'm a naturopathic doctor working out of Vancouver, British Columbia. By the end of today's video, I want you to know what a naturopathic doctor is, what naturopathic medicine is, and how we can help you. Let's jump right in. If you missed last week's video, go back and have a look to see what education a naturopathic doctor goes through to become a naturopathic doctor. Let's start on this week's video. What is naturopathic medicine? First, I want to let you know how the Association of Accredited Naturopathic Medical Colleges defines naturopathic medicine. From there, we'll jump into how we can actually take that definition and put it into practice. The Association of Accredited Naturopathic Medical Colleges defines naturopathic medicine as dedicated to the study and celebration of nature's healing powers. The core practice of naturopathic medicine is as old as healing itself and as modern as new medical breakthroughs. The profession incorporates a dynamic philosophy and recognizes the interconnection and interdependence of all living things. Naturopathic medicine prioritizes the most natural, least invasive, and least toxic therapies to treat illness and promotes wellness by viewing the body as an integrated whole. Naturopathic medicine is defined by principles rather than by treatment options. Above all, it honors the body's innate wisdom to heal and gives the patients lifelong tools for lifelong wellness. Let me know in the comments below if that definition of naturopathic medicine resonates with you, or if you think it's something completely different. There are 6 principles of naturopathic medicine that every naturopathic physician will learn when they go to school. They will then use these principles in their practice in how they interact with their patients and how we treat them. So let's go over those 6 principles now. First, do no harm. That's number 1. We just don't want to cause any harm to anybody. Secondly, we want to use the healing power of nature. The healing power of nature is your body's innate ability to heal. Every single body knows how to do this. If you think about it, your body does this all the time without you ever realizing it. A great example of this is if you've ever fallen and skinned your knee or your elbow, you didn't really have to do much, but maybe clean that wound and keep it clean. Your body went and healed that skinned knee or skinned elbow, and you probably got away with either no scar or minimal scarring. And that is our body's innate ability to heal. It just does it. Thirdly, we want to identify and treat the cause. So this is when we want to get into those long conversations. We ask a lot of questions to our patients because we don't want to treat based off a symptom. A lot of times the symptom, it goes a lot deeper. And we know that symptoms are messages from our body. Our body's saying something's wrong. We can't figure anything out. So we're going to give you this symptom and hopefully you'll take it from there. A great example of this would be someone coming in with acne. When someone presents with acne, we still want to ask all those questions, what they're eating, what their diet's like, how many bowel movements they have a day, what their sleep schedule is like, what kind of products they use on their skin, because it's rarely related to something topical. Acne is more commonly related to digestion. It's very common to be related to constipation specifically. That is because we are meant to have a bowel movement every single day. If you aren't, you're keeping toxins in your body that your body does not want. Again, your body's really, really smart. So it's going to find a way to get those toxins out. More often than not, it likes to use the skin. The skin is our largest organ and it's a huge organ of elimination. Think about it. You sweat, we're getting toxins out, we're getting heat out. So we can push toxins through the skin. It creates a rash or acne, but it does get our attention. And we want to treat the root cause of that acne and not the acne. Next, we have doctor as teacher. That is exactly what I'm doing right now. We do this with our patients every day. That's why our appointments are so long. We talk a lot. We want to tell you and educate you what your body's doing, what it's going through, and why, so that you have a better understanding, and then you're more likely to be able to help yourself get better. Next, we want to treat the whole person. So we look at you as an integrated whole person. We don't want to look at you as your symptoms separate from you or your mind separate from you. We want to consider all aspects of you, mind, body, and spirit, so that we can treat you as an integrated whole being, because that's what you deserve. Lastly, prevention. We want to prevent as many disease conditions as we can. In the most idealistic world, I think that we should be born, we should get our medical doctor, our naturopathic doctor, our counselor, our chiropractor. Think of everything we could avoid had we known everything before we got into it. So we want to teach everybody the proper way to eat, the proper way to move their body, proper way to think so that we don't fall into these disease conditions or end up with a whole bunch of symptoms. It is the best way that we can help you and that we can help you help yourself, because that really is the point. So that's what naturopathic medicine is. We want to help you become the best version of yourself and teach you how to do it on your own so that you can teach your friends, your family members, your children, and we can all get better and better as time goes on. If you have any questions or comments, please leave them below this video and we will be sure to answer them for you. Don't forget to subscribe and click the bell for notifications of a new video every week.